Good day everyone, I'm Rondon M. Pangilinan, student nurse from BSN 3A of NEUST. And for today's video, I will demonstrate nasogastric tube insertion. For the assessment, check for doctor's order. This clarifies procedure and type of equipment required. The next, client's level of consciousness and level of knowledge and understanding. Patient must be able to follow instructions related to nasogastric insertion to allow for passage of tube through nasal and gastrointestinal tracts. Also, we need to assess the availability and functionality of the needed materials because organization provides accurate skill performance. Also, check for history of nasal surgery or deviated septum and assess for patency of nares. This is to determine if there is a blockage, and we must also examine the history of surgery because if there is one, it indicates a thinning of the wall membrane, and when we insert the tube, there is a risk of injury. The next, determine presence of gag reflex. Because it is the defense mechanism of body, we need to determine if the patient is eligible to the insertion. Then lastly, assess mental status or ability to participate in the procedure. For the planning, before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction because different sizes intended for different ages. Then, prepare equipments such as large or small bore tube, non-latex is preferred, non-allergenic adhesive tape, 2.5 cm or 1 inch wide, clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw. Then, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug is also optional, anti-reflux valve for air vent if saline-sum tube is used, suction apparatus, safety pin and elastic band, and lastly CO2 detector is optional. For the implementation, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do. Therefore, it is not advisable to explain the procedure too far in advance because the client's anxiety about the procedure may interfere with its success. It is important that the client relax, swallow, and cooperate during the procedure.
Good day, sir. I'm Rondon M. Pangilinan, student nurse from Nasogastric University of Science and Technology. May I know your name, sir?
I'm Luis Leonard.
Okay po, Sir Luis Leonard. The procedure that I'm going to do is nasogastric tube insertion. A nasogastric tube is a special tube that carries food and medicine through your nose down into your stomach. Nasogastric tube can use for all feedings or for giving you an extra calories. So sir, can we start na po?
Yes, you may.
Then next, assist the client to a high holder's position if his or her health condition permits, and support the head on a pillow. This allows the nasogastric tube to pass more easily through the nasopharynx and into the stomach. Then, place a towel or disposable pad across the chest because nasal and oral secretions may be evident during the procedure. Bed linens and patient's gown must be protected. Then, perform hand hygiene and observe appropriate infection control procedures. For example, clean gloves. Hand hygiene deters the spread of microorganisms, and gloves protect from exposure to blood or body fluids. Then, provide for client's privacy.
How are you today, sir?
I'm good.
Oh, that's good to hear po, sir.
Assess the client's nares. We assess the nares for patency in order to check or make sure how open the nose is, and we choose the nostril through which the most air passes. Tube passes more easily through the nostril with the largest opening. Prepare the tube. Then support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the sigmoid. Mark this length with adhesive tape if the tube does not have markings. Measurement ensures that the tube will be long enough to enter the client's stomach. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Lubricant reduces friction and facilitates passage of the tube into the stomach. Never use non-water-soluble lubricant such as Vaseline, as it will not dissolve and may cause respiratory complications if it enters the lungs. Then insert the tube with its natural curve toward the client into the selected nostril, and ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx.
Sir, please hyperextend your neck po.
Dropping the head forward closes the trachea and opens the esophagus, which allows the nasogastric tube to pass more easily through the nasopharynx and into the stomach. If the client gags, stop passing the tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH, which should be acidic. The tube is in the stomach if its contents can be aspirated. Testing pH is a reliable way to determine the location of the feeding tube. Gastric contents are commonly pH 1 to 5. 6 greater would indicate the contents are from the lower, in the intestinal tract or in the respiratory tract. Confirm by X-ray. X-ray visualization is the only method that is considered positive. Or, place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. If the tube is in the stomach, you will be able to hear the air enter, a whooshing sound. If the tube is in the esophagus, injecting the air will be difficult or impossible. Then next, secure the tube by taping it to the bridge of the client's nose. This keeps the nasogastric tube in place. Securing the tube in place will prevent peristaltic movement from advancing the tube or from the tube unintentionally being pulled out. Also, this prevents the tube from pressing against and irritating the edge of the nostrils. For the evaluation, evaluate the patient's response to the procedure. Then document the procedure and other important data on the client's chart. Timely and accurate documentation promotes patient safety.
Thank you po, sir.